Sam Seder on the Majority Report. Emma Vigeland out today. I want to welcome to the program Gregg Gonsalves. He is a professor of epidemiology at Yale University. Wrote a piece 8 days ago before RFK Jr. was, I guess, publicly nominated, I don't know if officially, by Donald Trump to lead HHS, Health and Human Services. And before Dr. Oz of TV fame was named to be CMS chief. Welcome to the program.
Thanks for having me, Sam.
Let's talk about this. And I should say, I used to work with Bobby Kennedy, and his the anti-vax stuff had sort of peaked in like 2005 and then sort of simmered for years until probably about 10 years ago. And let's just start, I guess, with sort of like, let's start with this. The food videos he's been putting out, where he's talking about whole grain foods. I mean, give me your sense of like the value of that. Because I know that there's a quality of like, come for the whole foods, stay for the hepatitis and the HPV, I guess. But what's your sense of that element before we get on to sort of like the public health aspect, or to the extent that is public health?
It is all is public health. Even his prior work with river keepers and river cleanup, which I remember from being a citizen of resident in New York City for a long time, was public health. It was environmental health. But the point is that you have to take Robert F. Kennedy Jr. as a whole, right? We can pick and choose and say, oh yeah, processed foods, nobody should really maintain a diet based on, McDonald's and Burger King. It makes sense. But then as you start to widen the lens out, you realize we have a big problem here, because many of his views are, I wouldn't call them, I don't think it's accurate to call them controversial or out of the mainstream. They're just untrue. And often dangerous. So, some of the bits and pieces of what he thinks about may have kernels of truth in them, but the bigger picture paints a dangerous ideologue getting ready to assume the secretary role at Health and Human Services.
Let's talk about like let's start, I guess, with fluoride. He's recently come out with I guess saying on, he claimed that on, the day after the inauguration, they're going to get rid of the fluoride from our drinking supply. This is really a throwback, because I hadn't heard this in maybe 20 or 30 years, really go mainstream, this idea about fluoride. This is like chemtrails sort of level of discourse. But walk us through this, the fluoride issue.
So a couple of things. One is, I'm not old enough to remember, but in the 1950s, fluoridation was part of a big communist plot, right? It was really considered very subversive by the far right. And part of me probably hears echoes of what he's talking about in those long ago fantasies of the Red Menace. Look, fluoridation in the water is common in some places, uncommon in other places. What is untrue is that he makes sort of broad claims about the dangers of fluoride, which can be apparent at high doses, which none of us would imbibe in our tap water, and makes that the sort of forefront of his sort of campaign against fluoridation. The amount of fluoride in the drinking water is really, really negligible in terms of the side effects it can cause. And some people pointed to papers and reports that at double the dose, there may be some questions about cognitive development in children and stuff like that, but that's at like double the dose that we see in drinking water. So the currently available doses in drinking water, there are no significant problems in terms of the consensus of the scientific literature. We take more fluoride out of water than we put in. There are many places around the country out west where we're dealing with having to drill new wells because there's too much fluoride in the water. This is taken very, very seriously by the federal agencies that supervise this. There's been some suggestion by Lena Wen in the Washington Post last week that maybe he has a point on fluoride. Europe doesn't fluoridate its water. but Europe also has the highest level of dental caries across the WHO region. So, like, fluoride has been a very important public health intervention in preventing tooth decay in children. We have other access to fluoride through fluoride toothpaste and other sort of vehicles for fluoride introduction into our dental hygiene. But this is not an issue that anybody should really be too concerned about. And again, he takes something that may have a scintilla of truth in it in the context of an enormous dose of fluoride and turns it into this broad-based sort of environmental poison.
And we should say, like 50% of fluoride intake that you get, like you say, it's from our water supply. Half of levels that even on a consistent basis, there was some correlation, and that study that came out, I don't know, 8 months ago or so, is not nearly as definitive as people like to make it. But my understanding is half of the fluoride that we ingest leaves our body within 24 hours. The rest is in our bones and teeth, where we want it. And the other note I would make about Europe is that those countries have much wider access to dental care than we have in this country.
Exactly.
And if you pull the fluoride out of water, the first cohort of people who are going to have real serious dental issues, and we should say that's a real health issue. I mean, the stories of kids getting infections and it killing them, literally, will be people living in poverty. I mean, this is who's going to get hit by something like this. They did this in Calgary, you wrote as well.
Yeah, I mean, look, that's an observation that Calgary pulled fluoride out of its drinking water several years ago. Now they're putting it back in next year. What they saw is an increase in cavities, infections associated with severe dental decay among kids, needing to put them under anesthesia and under antibiotics for infections. Look, we can have an educated, evidence-based discussion about dental care in the U.S., from fluoridation to the availability of dental services across the country. Remember, most health insurance doesn't pay for dental care. But this is not the conversation that we need to have as a nation about whether it causes cancer or other sorts of serious health events when it simply isn't true.
Let's talk about vaccinations. I mean, I think, this audience is very familiar with Kennedy saying, when I run into people on a hiking trail, I'll tell them not to vaccinate their kids, and hopefully they'll hear it enough times that maybe they'll hesitate to do it. He said that vaccinations he does not consider safe. He's made proclamations like, well, we don't need to make vaccines mandatory. If a vaccine works for you, then, you can still have access to it. But that's not what public health is. Can you walk us through, at least conceptually, what public health is?
Well, that's a big ask, but we can talk about it in the context of vaccines. We've seen whooping cough, measles outbreaks across the country, right? And by and large, they're associated with a decrease in vaccine coverage across a population to a level in which herd immunity, the ability not just for you to protect yourself with a vaccine, but to protect your neighbors with a vaccine, is gone under. And so you've seen it in religious communities in the U.S. You've seen it. To be fair, this is not only a sort of far right obsession. You see it in the context of liberal enclaves like Vashon Island in Seattle, in which rich liberal enclave. So if we're going to protect ourselves with vaccination, it means that you have to get vaccinated and I have to get vaccinated. We need everybody around us to be vaccinated to protect us against measles outbreaks, diphtheria outbreaks, etc. And one thing is he may frame as an issue of personal choice. But when you have a measles outbreak that happens in a community, there are millions of dollars that happen in terms of healthcare costs, cleaning up that mess, in addition to the pain and suffering of the families involved. And so he's socializing his own personal preferences and making us bear the risks, right? So the community bears the risks of what is supposed to be our personal choice to you do you version of public health that's been popular a little bit in certain circles.
Talk about the notion of public health in the context of there are like any medication or any medical procedure, there are risks, right? There's no, I don't know if there's any medication you can take that is 100% safe, across the board. Certainly no medical procedure that you can take is 100% safe. But the idea is that good health weighs these risks. And in the context of public health policy, there are, of course, people who are going to have side effects, sometimes severe, to any vaccination or any medication. But the idea is that the number of lives who are at risk by this versus those who would be at risk if we do not provide, let's say, vaccinations. But this could apply to other, sort of like procedures. There's some risk in getting a colonoscopy, but you're going to save much more lives than you will lose across a population. That's there seems to be like some like complete deficit of thinking in that way, or an ideological one that is basically saying like we can't have this concept of public health.
So a couple of things. One is, if you get a colonoscopy or I don't get a colonoscopy, that's a personal choice, right? I'm not going to give somebody else cancer by my decision not to have a colonoscopy. But again, we are transferring the social cost, the economic costs of my cancer diagnosis onto the general public because it gets paid for by taxpayers, by increasing healthcare premiums. But that's in the context of medical care. In the context of public health interventions, we do these because they have broad-based effects on each other. Vaccines don't just affect you; they affect the community you live in. As you said, everything has side effects. And as they say in toxicology, dosage is the poison, right? If you have high doses of anything, you're liable to get into trouble. But in the context of fluoridation, we have very, very few, pretty small doses of fluoride in the water. In terms of vaccination, yes, there are side effects of vaccines. People have been seriously affected by vaccines. That being said, when you broaden the lens out and you look at the millions and millions of people who've taken vaccines around the country, by and large, the vaccines we take are safe and effective, and really transformed American healthcare. My dad had polio, right? He was born in 1929. By 31, 32, he had polio, and he could have died, right? And he suffered the consequences of that infection for the rest of his life. I am sure if my dad was alive today and said, "Would you rather have not had polio?" I think he would have said yes, right? Nobody seems to remember those days when schools would close, when community centers would be shuttered because polio was rolling through town. We do not want to go back to the bad old days where we saw measles, mumps, rubella, polio, other kinds of infections race through our communities, creating havoc both personally and socially.
And much of this, much of the traction that Kennedy got was because of COVID, frankly. I mean, had we not had a pandemic, had we not rolled out vaccinations for this, I think he would have had much less traction. This was very, very helpful for him, I think, in terms of his career aspirations. Hey, folks, don't forget to hit the subscribe button and check out our daily show. We do it every day at 12 p.m. Eastern for about 2.5 hours. We even take phone calls. You should check that out.